Let's be real. When you think about your skeleton, you probably picture a solid, permanent frame, right? Kind of like the scaffolding of a building. But what if I told you it's actually a living, breathing battleground? A super dynamic system that's constantly at war with itself. Yeah, let's take a closer look at this secret life happening inside your bones. So get this, what if your entire skeleton was completely replaced every 10 years? It sounds like something out of a sci-fi movie, doesn't it? Well, it's not. It's exactly what's happening inside you right now. Through a process called bone remodeling, your body is in a constant state of renewal, basically giving you a whole new skeleton about once a decade. So what is this living structure even made of? Well, it's mainly two types of bone. You've got the super dense, tough cortical bone, which makes up about 80% of your skeleton. That's the hard outer shell that gives you all your strength. And then on the inside, you have the other 20%, which is this spongy-looking network called trabecular bone. It might look delicate, but it's way more metabolically active. Think of it like a building. You've got the strong exterior walls and the busy internal framework. Now, here's where it gets really interesting. What are our bones storing? Well, this number, 99%, that's the amount of your body's total calcium that is locked away inside your skeleton. So your bones aren't just a frame, they're your body's personal mineral bank. And believe me, this account is incredibly active. Okay, so if it's a bank, who are the workers? Who's managing all these constant deposits and withdrawals of minerals? Let's meet the microscopic renovation crew that's on the job 24/7, tirelessly remodeling your bones from the inside out. So this crew basically has two main teams. First up, you've got the builders, the osteoblasts. Just remember B for builder. Their job is to lay down new bone material. And on the other side, you've got the breakers, the osteoclasts. Their whole gig is demolition. They break down old bone to release minerals and, make way for the new stuff. Both of them are absolutely essential. And this right here, this is probably the most important concept of the whole thing. For your bones to stay strong and healthy, the work of the builder crew must be perfectly balanced with the work of the demolition crew. If one side starts to get a little too powerful, the entire structure is at risk. It's all about that balance. So how does the body control this delicate dance? It's managed by this surprisingly elegant go and stop signal system. So the builder cells, weirdly enough, release a go signal called RINC-L. When that signal latches onto the breaker cells, it's like a green light for demolition. But the builders also release a stop signal called OPG, which acts like a red light by literally getting in the way and blocking that go signal. Pretty clever, right? Okay, so if the cells are the crew and the signals are the traffic lights, who's directing all the traffic? The answer are hormones. They're the site managers, the bosses, pulling all the strings, and telling the crew when to work and when to take a break. And there are a few key managers on the job site. You've got parathyroid hormone, or PTH. It jumps in when your blood calcium gets low and tells the breakers to release some from the bone bank. Vitamin D is like the supply manager, making sure you can actually absorb the calcium from the food you eat. And then there's estrogen. Estrogen is a super critical manager that acts as a powerful brake on the whole system, specifically slowing down that demolition crew. So, we've seen how it's supposed to work, a perfectly balanced hormone-managed construction project. But what happens when that balance breaks? Well, this is where we get into the science behind a disease many of us have heard of, osteoporosis. For many women, there's one specific event that can throw this entire system into chaos. And that event is menopause. It completely changes the game. Remember that protective hormone, estrogen, that was putting the brakes on the demolition crew? Well, during menopause, estrogen levels just plummet. And just like that, the brake is gone. The demolition crew, those osteoclasts, they just go into overdrive, breaking down bone way faster than the builders can replace it. This is what leads to osteoporosis, a condition where bones become dangerously weak and brittle, which, as you can imagine, dramatically increases the risk of a fracture. But listen, this is not a one-way street. The story doesn't just end with bone loss. We actually have some really powerful strategies for fighting back, for intervening in this process and tipping that delicate balance back in our favor. And it all starts with lifestyle. Things like weight-bearing exercise literally send a signal to your builder cells to get to work. Making sure you get enough calcium and vitamin D gives them the raw materials they need to do their job. And of course, simple things like preventing falls, stopping smoking, and limiting alcohol all help protect the structure you already have. We can also intervene with medicine, and the strategies are pretty cool. Most medications work by reining in that out-of-control demolition crew. Bisphosphonates, for example, are kind of like throwing a wrench in the osteoclast's machinery. Denosumab is even more precise. It directly blocks that go signal we talked about earlier. And what's really amazing is that some drugs, like teriparatide, are unique because they actually work on the other side of the equation. They stimulate the builders to create new bone. Now, for anyone dealing with this, it's really important to know that the most common starting point for treatment is this class of drugs, the bisphosphonates. They're the frontline defense because they're just so effective at slowing down that overactive demolition crew. So what's the bottom line here? What's the big takeaway? It's that your bones aren't just some static part of you that you're born with and that's it. No way. They are a dynamic, living tissue, a lifelong renovation project that really needs your attention. If you remember just one thing from all of this, let it be this. Your bone health at every single stage of your life comes down to a dynamic balancing act between the cells that build you up and the cells that break you down. So I'll leave you with this question. Now that you know your skeleton is in this constant state of flux, always being rebuilt and remodeled, what is one thing, just one little change you could make, maybe starting today, to help tip that balance in your favor?